when you're a sole practitioner, at a smaller organization, you wear all the hats. And so you're really truly a generalist. And there may be things that pop up like an exposure, or for me at Montclair, we had a measles outbreak that started at Disneyland. And then we had Ebola that we were prepping for, where you have an opportunity to really specialize. But for the sole practitioner, again, a little bit of everything, but you don't get an opportunity to really specialize and dig deep. And so something that's been kind of a trending factor in my, professional life is I have this overarching understanding, and then I want to know more. I want to dig down into things. And so by working at different patient populations, you really get an ability to dig down in different ways. And then understandably, different patient populations have different risks. So for example, a pediatric hospital, there's a lot of concern around cohorting and respiratory season. And, children have different types of diseases and different types of infections than adults have. When you work at, predominantly an acute care hospital that's maybe more surgical, your length of stay is shorter. And so you're more focusing more on maybe surgical site infections and getting Foley's out. When you work at, organizations that have a higher acuity of patients, they're sicker. There's more comorbidities. And so again, how you approach that as an IP and how you dig deeper into that knowledge base just evolves. What I will say I loved most was cancer. And what I love most about cancer is really the pathophysiology, but also just how these patients could really have no immune system, and who got sick and who didn't, and maybe those factors why. So when you're dealing with a patient with a 0 white blood cell count, things like whether or not they perform CHG bathing, or whether or not people are washing their hands, or whether or not we used aseptic technique, I think has a lot more impact than when you have a patient who's immunocompetent. And so I think for me personally, being able to work in these different patient populations has really allowed me to really develop a really beautiful lens and see things again from that risk perspective. For people who want to specialize, I would definitely invite them to think about how do they want to specialize? What are those areas of expertise? And then there is generally an organization that would support that. So pediatrics, might be more, respiratory viruses, more about, cohorting patients, more about navigating pathophysiology around really complicated surgeries, or patients with this complex genetic disorders, such as cystic fibrosis that maybe don't make it to adulthood. If you're looking at, again, kind of more of a general, smaller acute care hospital, you're going to get a chance to play with everything. But again, you may not have an opportunity to become more expert. And then again, cancer, you're really dealing with those HAI surveillance definitions and really these disease states that you just won't see anywhere else. But I will say what I think has been good for me is all those places that I've worked really led me to UCSF, where literally they do all the things that you talked about. We've got pediatrics, we've got cancer, we have a couple smaller sites, we have a couple larger sites. And so having worked where I've worked, how I've worked, I'm really able to approach my role, I think, in a more successful, kind of more well-rounded, more experienced fashion than I would maybe otherwise.